Hi, my name is David Bell. I'm the Chief Executive Officer for Pasadena Network of Services. I am very pleased today to be joined by Virgil Stucker, Virgil Stucker and Associates. Virgil is the President and CEO and is a program and therapeutic advisor to several families and their clients. So it's great to have you today, Virgil.
Great to be here, David. I'm really glad to be here.
Looking forward to talking to you about a number of topics. Virgil, describe for me what residential treatment is. How do you view residential treatment?
What happens after hospital? So often there can be a real gap between hospital stays, which are shorter and shorter, and that outpatient service, which may be sufficient for some. But in that gap, there's often a need for ongoing stabilization and for further integration of this person that's been through this very challenging mental health condition. It's a sense of 24/7, you're in a milieu that is very caring and supportive. Filling that gap not only with that 24/7 supervision and support, but with excellent clinical support. So it's sort of a mix of milieu and science.
Okay.
For what purpose? To help these people who've really been disintegrated by their mental health condition to start re-achieving social integration.
What are some of the benefits of residential treatment?
Consider the mental health conditions, the mental illnesses that we know so well through the families that come to us for the help that they seek for their family member. The mental health condition often creates a sense of disintegration, of isolation, of loneliness, of confusion. So yes, you may be in hospitalization where you are maybe stabilized, where you're no longer at crisis, no longer, quote, a danger to yourself or others. But yet you're still in the middle of a mental, emotional, maybe spiritual crisis and feeling so alone. So imagine then the residential treatment center where you can go and not feel so alone anymore, with peers, with clinicians, with very supportive staff, to start helping you reintegrate, to start helping you feel like you belong in the world again, like you have a sense of purpose, and in real time, helping you to learn the skills that you need to cope with the symptoms that you have. So what are the benefits? Goodness, it's the restoration of the capacity to really live again a fulfilled and functional life that can, absent residential treatment, perhaps be lost for someone, relegating them to some kind of chronic care state. We do so much more for them in residential care.
You and I have talked a lot about this topic, but why is it important to have the right kind of culture in a residential treatment setting?
It's all about the culture, I think. If you talk about short-term inpatient stay and then outpatient work, so much of that is about the science. How can we reduce what's going on to the point where we can find the perfect psychopharmacological mix, along with maybe an incisive therapeutic intervention and everything's going to be fine? It takes much more than the science for these complex people. So you need an environment where the milieu therapy that this person experiences is imbued with a sense of emotional and physical safety, kindness and respect. They have a sense of participation and belonging. There's also a heightened sense of empathy and mutuality. Overarching, you have to have a staff surrounding them that actually believe in them when they might not believe in themselves. So you have this appreciative environment wrapped 24/7 around this person who is vulnerable, disengaged, helping them to feel like a real human being again. That kind of culture is essential. And I know that that's so important to you with your team at Pasadena as well.